Hello, my name's Adrian Richards. I'm a consultant plastic and cosmetic surgeon, and I'm also the surgical director of Aurora Clinics. Today I'm going to be talking about replacement of breast implants. This is an increasing problem, and I'm seeing more and more patients who are coming to me to sort of ask, should I have my implants exchanged? What are the pros, what are the cons? So basically, implants, current ones, we estimate they last about 15 years, so you probably need them replaced after 15 years. But what I tell my patients is, if there isn't a problem with the implants, you don't necessarily need to change them. So if you've had breast implants 20 years ago, your breasts are nice and soft, you've had an ultrasound which shows that the implants are intact, there's not a problem, you don't need to change them, because in fact, an operation has risks in itself. So if you're happy with them, you haven't got any problems, probably best to leave them alone. Okay. If you have got problems, now what can these problems be? These problems can be capsulization, which is basically when the implants go firm. So normally when they go firm, and this is the body forming a sort of capsule around, a lining around the implant, which compresses, makes them go firm, and often high. Okay, so the implants are slightly higher with the breast slightly lower. So that's capsule formation, which I've talked about in another video, which is an indication for changing the implants. Another one is if there's any indication that the implant may have ruptured. So if you feel there's been a recent change, we'd normally arrange an ultrasound or an MRI to look at the integrity of the breast implant, and if there is any rupture, that is a good reason to have them removed and replaced. Another reason might be what's called a silicone granuloma. So sometimes you can get lumps under your armpits where the sort of sieves, you have lymph glands which act as sieves under your armpit, and they would drain any silicone. So if there is any silicone bleed, which is sort of a slight ooze from the implant, that can cause a lumpiness under the armpit. And again, that's a reason to remove them. The final main reason is you're not happy with the aesthetic result of the implant, and they may have been fine, but they've changed. Maybe you've had pregnancies, or your breast shape has changed. So that is an indication if aesthetically you're not pleased with the appearance of the breast. And in particular, I'm seeing a lot of patients who've had the implants put in a submuscular position. That's under the pectoralis muscle, where the implants lie high, because the pectoralis major muscle tends to hold the implants high, and with time the breast tissue itself goes down, and this leads to a phenomenon called the double bubble effect, which I'll talk about in another video. So essentially, if your breasts are okay, you haven't got a problem, probably best to leave them alone. If you've got any of the problems I've just talked about, you could consider having them removed, but you need to think long and carefully about the pros and cons of doing this. So thank you very much for listening to the video. We hope to see you soon, and please feel free to contact us at any time, either via the website, email or phone, if you'd like to arrange a consultation or just like some advice.